For the next session, I would like to invite Colonel Binu Sharma ma'am, Chair, CEO, INS India, Founder Member, ANI, Mrs. Gopa Hazra, Co-Chair, Founder Member, Treasurer, E-Zone, ANI, one of my inspirations in life, Dr. S. Narayani ma'am, Business Head, Fortis Hospitals, Maharashtra region, and someone very dear to me, Mrs. Sindhu Nair ma'am, Nursing Superintendent, Tata Memorial Hospital, Member, ANI. A huge round of applause for our speakers. Thank you.
Namaskar, good afternoon. After a fantastic lunch, I urge you not to go to sleep because we're talking not just care, but care and money together. And you all know we are running through a difficult time across the world. LPG prices going up, fuel prices going up, food going up, vegetables, perishables, everything is going up. Hence, nurse leaders and all healthcare leaders have to be equally conscious that money is as important as devising, planning, and executing care. So healthcare is not just about clinical excellence or safety. It is equally about how wisely we lead as leaders, allocate resources, support the teams who work with us, create systems that define safe, compassionate, yet resilient or sustainable care. That's a tough task. The economics of care, a topic very, very close to my heart. I do not know, in many conferences, I get a topic designed around financials, healthcare economics, or so on and so forth. And why that is, because a long time back, about 15 years ago, maybe a little longer than that, 20 years ago, when I started sitting for board meetings for the business reviews, I realized I know nothing about margins, EBITDA a little bit understood, cost of goods sold, COGS, cost per nurse per bed per shift, cost per patient per day, revenue per nurse per day, etc. These dashboards were very, very alien and new. And I think this is the case for many of us who reach the leadership position but still have not gotten ready for it, especially in the financials. I heard in the panel when Dr. Parag was speaking that when we will give you a chair in the boardroom. Are you ready for it? So nursing leaders, nursing friends, all out there in the hall, I'm asking you, if tomorrow you are given a position in the boardroom, are you ready in every single aspect? Do you understand care, safety, compassion, empathy, and financials as well as you understand care? Do you understand your teams? If you do you have enough conviction, confidence, and the right strategy to stand up for them in the boardroom? Because what is the influence a nursing leader can do in the boardroom? Same time, what influence can she be of when it comes to financials? Can care define financials? Is care a cost? So should we not spend in care? We heard that if the hospital is running through low EBITDA, low margins, low net cash flow, cut down numbers. And whose numbers are cut down? Caregivers, which is nurses, which is GDAs, attendance, because those numbers look larger to everybody. But leaders must understand, if you compromise on either the quality or the quantity of people who care for patients, your economics of the hospital are going to be directly impacted. Hence, today to discuss this very interesting topic, we have with us my co-partner, Ms. Gopa Hazra, as co-chair. We also have Dr. Narayani, a regional director from Fortis, ex-VOCA, only this much I know. I just met her 2 minutes ago. We also have our very dear friend, Sindhu Nair. They would be taking up 2 presentations, post which I will throw some questions, which is not part of panel design, but that's how we function. Be ready for the rapid fire, a few questions, and then Ms. Gopa Hazra will wrap up. So let's talk about how leaders can design platforms which are equally focused on care and equally focused on the financial stability or economics, and they do not compromise on patient care because of the financial pressures. And nurse leaders, my request to all of you, have your role clearly mapped and defined when it comes to influencing, whether it is technology. Technology is a very, very high cost. Hospitals usually shy away. Patient monitoring systems are a high cost. Hospitals will shy away. Even if 2 levels have approved it, the managing director or the CFO will say, that's very high cost. What does that high cost of technology do to your patient care? It makes your team more efficient. It creates accuracy, timely documentation, safer care. We need our teams to be really in a great mental and physical state. If you provide efficient platforms, whether technology or people or processes, care is always going to improve. Clinical outcomes will improve. Patients will go with a great experience. Nursing leadership and the hospital leadership will smile with a lot of gratification because everything is in order. All is well. We remember the movie 3 Idiots. So with that, let me just invite Dr. Narayani first for her insightful presentations, and let's see what we learn from the deliberations, how we can influence. Thank you. Over to you, Dr. Narayani.
Good afternoon, everybody. It's my pleasure to be here today. Pleasure simply because I think I'm in a room which has seated here a very large number of nursing leaders who are not just nursing leaders, who I think are the movers and shakers of healthcare today. They have been so in the past, and they are very rapidly becoming stronger and stronger, most impactful people in a hospital and healthcare today. So Colonel Binu mentioned whether you all are ready for getting into a boardroom. My own experience is, you all are now not going to be asked whether you're ready to get into the boardroom. You all are going to probably knock and say, we are the best to get into the boardroom, so make way for us. So on that note, let me share my thoughts on what I think on this subject given today: leadership, economics, and the bedside operations. Can I have the next slide, please? There was a time when we said healthcare and looked for what are the headlines which healthcare evokes. It would have been some fantastic surgery, it would have been some brilliant doctor, it would have been some very, very new medical technology and all of that. But today, if you try to search for topics on healthcare, these are the kind of headlines which you see in newspapers. I'm sure all of you agree with this. This is showing how many billions, who's invested, which hospital is expanding, which hospital is being taken over. And I know many of these hospitals which are mentioned here, there are people sitting in this audience who belong to this hospital. So these hospitals, from becoming small places of care delivery, are becoming mighty institutions where lots and lots and lots of money has been put in to deliver care. So that's a great thing which is happening in healthcare. Healthcare has become totally center stage of what's happening, and entire industry focus is on expansion of healthcare. Expansion of healthcare is always very good for all of us, every stakeholder. People like us who work in healthcare, the patients who come to us, because healthcare has always been a not very well developed area in India, and now that's rapidly changing. But then this is not the only change. What else is changing? So let's take a look at what healthcare has become in the last 2 decades. And I'm sure all of you will agree with me when I say healthcare, there was a time when it was reactive care, which has become totally patient-centric care now, proactive care. So there's paper-based systems, limited digital integration, urban-centric access, treatment-focused care, departmental silos. This is what defined healthcare 2 decades ago. Today, where are we? Digital hospitals, data-driven decisions, insurance expansion, patient experience focus, operational integration, telemedicine growth. And then where are we going to be tomorrow? AI-assisted care, predictive and preventive healthcare, connected care ecosystems, personalized medicine, smart hospitals, value-based care. This is the spectrum from where to where healthcare is headed. Given that, what should the healthcare leaders of tomorrow really know? There was a time, even when we started off as healthcare leadership, there was a certain set of things if we knew, we were good enough. If we knew how to do good operations, good operations then meant good clinical outcomes. If we knew how to do that, if we knew how to run your quality systems, we made for good healthcare leaders. But today, what is a healthcare leader really required to know? Must have a very good understanding of digital health and ecosystems, understanding of AI and data-driven healthcare, very much understanding of consumer behavior and patient experience, healthcare economics, value and value-based care. Every penny which put in needs to give you a return, integrated care models, operational excellence, very, very important change management, and I think that's an area which all of you are all the time dealing with, regulatory and policy landscape, workforce dynamics, future of care delivery. So the spectrum of what healthcare leaders must know has really expanded into another zone which is quite far removed from clinical alone. So the brain of a leader should tick with strategic thinking, communication and collaboration, operational and functional acumen, innovation and digital transformation, ethical and inclusive leadership, and change and team leadership. These are very complex areas which every single leader needs to have developing in his mind. In this, if you see and break it up, strategic thinking is one part of it, which would, I would say, be about 20% of what you need to know. This is all about the expansion, this is all about where the future will come, this is all about how many beds where and all of that. A bigger 80% is still in the zone of operations, but that's made operations, patient care, but that's made a lot more tough because we have to deal with the economics of running healthcare. So now let's come to the actual subject on operational finance impacts and bedside care. Given what's happening in terms of the investment, the return on investment, which now everybody understands, isn't actually quite amazing that in a whole nursing conference we are talking about ROCE and things like that. So the way healthcare is, there's an expectation on return of investments. Every leader would want that. So when you get into the economics, you want to maximize what your returns are from your resources, from your infrastructure, and from your manpower and your technology. So how do you do this? And then, when you are delivering this, is your patient completely happy with just that delivery? The patient expects, actually the expectations have risen, and they expect personalized care, they expect a lot of empathy, and they'll expect absolutely customized care. Now, given all of this, these two, do they balance out? We talked about the economics. When we talk about economics, like she mentioned, if you have to maximize utilization of your resources, first comes your manpower. So we often think, Colonel Binu also mentioned, that should be cut down manpower. What would be the impact on your bedside operations? There would be fewer people, patient dissatisfaction, improper care, and the likes. Similarly, your OT utilization in all of these areas, if your operational drivers, if your economics of the operations were to drive the changes to give you the operational bedside improvement, you are not probably going to get anywhere. Turn it around. Can the people who are experts at bedside operations decide what should be the economics of operations, not the other way around? Economics deciding the bed care, rather than that, turn it around. And who better than people like you all sitting in this room? So for instance, can we control, for better utilization of your resources, you need better utilization of your manpower. One of the biggest things is your length of stay. Every time we run into issues with beds not available because of higher occupancy. This is the constant dialogue which every morning Sister Minnie and I have. She would say that occupancy very high today. And I said, can't it go a little higher? She'll say, give me more beds. I don't think she needs more beds. And I'm sure she has the ability to work on length of stay. Now, who better than y'all to have a system where you predict a length of stay and make that stay of the patient in the hospital so efficient that he comes in and goes out faster, and in the same number of beds, you're able to turn out many more patients, and so that bedside initiative by the bedside team leads to better operational economics. So similarly, consumable management, infection control, keep the patient free of infection, good OT utilization, staff and skill mixing. How do you go about this? Use technology, decide what is the kind of acuity you need, think differently. You don't need, there's a way of thinking it. You can have skilled workforce and you can have registered nurses, you can have different people working for different areas. And similarly, one of the things which all hospitals talk about is your discharge planning, turn patients around faster. What would be the impact? You will definitely have better outcomes, you have faster throughput, you have better capacity utilization, and in all of this, the patient experience also remains intact. Very importantly, the old model is the mindset shift that builds tomorrow's healthcare leaders. The old model of siloed thinking needs to go away. And instead, the people who do operations should not think of finance in isolation, operations in silos. So finance and operations need to get integrated. It can't be a clinical only focus. It can't be a department-centric decision. It cannot be a cost-focused mindset. A future leader needs to understand the full ecosystem, end to end. They need to connect with strategy and empathy. They must balance care and operational thinking. There has to be cross-functional collaboration and absolutely value-driven decision-making. So the great leaders are going to be those who will break the silos. They will connect the people, processes, and purpose, and to create better outcomes for patients and communities. So it's all the same things which we do, But we do it without silos, and the same individual now develops a 360-degree perspective to better utilize your resources. So the question, how do we reduce costs? Wrong question to ask. Better question, how do we build sustainable systems that improve patient care while remaining financially responsible? Financial sustainability, patient trust and clinical quality, care and operational excellence, these are the way to grow. Create value, build trust, and strengthen the future of healthcare. This is something which in small ways all of us do even today. Today we have the advantage of data being available, there is advantage of technology being available, which can do a whole lot of things much faster and much more efficiently. So if you were to put at your bedside your planning and use this technology and use the data available to appropriately manage, you probably are going to give in a lot more inputs which will improve the economics of operation. So as leaders, we build today, what we do today will define the healthcare of tomorrow. So fundamentally, I would say, the way to go about this is to think beyond silos, collaborate across functions to create integrated patient-centric solutions, lead with data and humanity. Sometimes we go so much into the data, we get impersonal. That's not the way to be. The empathy and the human touch remains intact, and that's why you make for better leaders. However, the objectivity with the data must come in. That's the change we have to make. Your decisions would be much better if they are data-driven, but the patient, you never forget the human stories behind every number. Balance care with sustainability. Build financially responsible systems that ensure quality care for all, today and tomorrow. Every operational decision must ultimately improve human lives. So that reality, which is the underlying theme, which comes from days gone by, that doesn't change. The empathy and the care for the patient doesn't change. What changes is how we deliver this. So, behind every number is a human story. Behind every decision is an opportunity to heal. So to all of y'all, lead, connect, care, transform. There's a great need for strong leadership in healthcare today. Healthcare is exploding. There are very few people who understand those nitty-gritties of bedside care. The people who do that best are you nurses. And what do you need to add to whatever you already know? Use technology. In conversations over lunch, I heard about very good AI programs which tell you a lot of things which you can do away with the human part of it. Put all of these together and you come out, emerge as a very responsible, economic, understanding healthcare leader of the future. Thank you.
Thank you, Dr. Narayani, for being dot on time, 40 seconds before time. Now we listen from Ms. Sindhu Nair about value-based care. Over to you, Sindhu.
A very good afternoon to all of you. Before I start, thank you, Annie officials, for bringing all of us together for the beautiful networking platform. So before we move over to value-based care, let me ask you all about the heavy lunch what we all have had. So we have had a beautiful lunch, a comforting lunch. So let me ask you, how do you define the lunch? What were you thinking about when you went for the lunch? How do you value your lunch? When you go for lunch, what do you think about lunch? What are the qualities you look for lunch? Varieties. Let me ask people who are sleeping over there, because the front people can't sleep much. You're getting caught in the videos. The people who are not getting caught in the videos, let me ask. So over here, the officials have told varieties who chose the lunch. Let us ask people who could not choose the lunch, what were you looking for? Yes? Taste. What else? Yes? Choice. What is that? Appearance. Okay. Appearance, taste, variety. What else? Nutrition. Nutrition. Excellent. What else? Hygiene. Excellent. Beautiful. So when we went for lunch today, these were the thoughts which came into our mind. One was nutrition. Second was hygiene, because we were worried about our safety, because on Sunday many of us have to go to work. And one was variety, appearance. So this was a value which we gave to our food. So this is very important for us to understand what is the value we give it to our care also. So going over to the slides, so I'll be speaking about driving clinical outcomes through value-based care. So what is value-based care? Let me take you all through value-based care. So what is value-based care? What is clinical outcome framework? Implementation at the hospital where I come from, the solutions and the way forward. So this is a beautiful definition given by the professor from Harvard, that is Michael Porter, that is, what is value-based care is the value which is equal to patient health outcome achieved per dollar spent. That is, whatever we spend should be achieved from what we get. So how was it derived? Now, what was it told was, in an organization, what are the number of tests which is performed, how many bed days was used. But now there has been a change. The change is whether the patients are safe or not, whether the care is accessible or not, whether the care what we are giving is, whether the care is accessible, whether the quality is provided. So this is how the value-based care is defined. So what are the three tools for value-based care? That is quality, cost and access. So what is it? Quality. If the quality is not affordable, it is not acceptable. So next is cost. The cost which is not affordable to a patient, the patients won't be able to go. Now the next is access. If the patients who are not able to access the care, if a poor person is not able to access the care to any of the place where the patient is going, again it is not accessible. So the model will collapse. That is the reason why these three important the three tools, quality, cost and access, is very important for the model to be a success in value-based care. And that is one of the reasons why, as we spoke about in food, safety, hygiene, appearance, this is the reason why we think about all this when we go to an organization. And that is one of the reasons why, according to me, the nursing defines the quality of an organization. If the nursing is good, the organization will succeed. So value-based care is directly is proportionally to the quality what is given to the organization. Now let us speak about what is happening in the healthcare economics. In the healthcare economics, over here, GDP, let us see, only 3% is used as compared to the global GDP in the healthcare scenario. Now, in the doctor-patient ratio, that is 1:1 1,456, whereas in WHO the ratio is 1:1,000 doctors. That is one doctor to 1,000 patients. So what does it mean? It means to say that the nurses are burdened. That is the reason why nurses have to be more specialized and more trained in giving care. Only then they will be able to give value-based care to the patient. 65% of the patients are out of the pocket. It means to say that most of the patients are not covered under government insurance. 54, the Ayushman Bharat, 54 crore patients are getting covered under the Ayushman Bharat. It is a beautiful government scheme coming under a defined package. It means to say that they are having a defined package, and nurses have a very good, beautiful role. So we have to be more into capacity building so that we can meet that target. Now, what is the domain? These are the 6 domains over here: patient safety, clinical efficiency, patient experience, care coordination, evidence-based care, and cost effectiveness. Now, what is all this? The 6 domains, unless and until we come together, we will not be able to give the value-based care. Now, let us speak about patient safety over here. Now, the most important is, when you speak about patient safety, unless and until the strategic roles of all these 4 come together, we will not be able to take the 6 domains together. Now, when we speak about care coordinator, the nurse becomes a bridge specialist. That is, we have to become the care coordinator only when we have something like the nurse-led clinics. So when we speak about the care coordinators, we have to, these are some of the specialized clinics which you can see not only in Tata Memorial Hospital, but many of the hospitals. I was speaking to many of the nurse directors over here, the nursing heads who are having the specialized clinics, who can bring about focused care. So over here, Colonel Binu as well as Dr. Narayani was speaking about cost effectiveness. How can we bring about the average length of stay down? This is the way how we can bring about focused care and bring about the give better care to the patients. So this is about bringing about better patient experience also by bringing about focused care to the patient. So this is the extended role of nurse to the patient, and you can have a look how nurses can expand and extend their role in different scenarios. So this is the central venous access device clinic, breast clinic, stomach clinic, pain clinic, palliative clinic. In the morning itself, you heard dignitaries speaking about nurse practitioner. There are many nurse practitioners, there are few nurse practitioners course available. There are nurses working in the critical care unit, and these are other than this, there are breast BMT nurses also. Now speaking about patient educator and quality champion. Now let us see what is happening in that scenario. So this is something which is not new to you all. We are having emergency warning score. We are having pediatric emergency warning score. And this is about patient educators. Now what happens over here? There are a lot of support groups in which the patients can be helped by the nurses. Now how does this bring about value-based care? Because why this? The patients can be helped because this impacts the patient outcomes, by which they know that how are they supposed to take care of themselves, and there are many groups by which the nurses are becoming the leading force in taking the patient care ahead. Unless and until a clinical nurse specialist or a coordinator comes ahead and holds hand with the patient, they will not be helped because patients are in contact with the doctors only for 5 minutes, whereas for nurses, they are with the patients for a long time. There are people who have spoken about the nurses as backbone, central nervous system. They are the connective tissues who hold everybody together. So, the key nursing initiatives, there are people who are with the multidisciplinary tumor board. They are structured chemotherapy patient education programs, nurse-led pain assessment, mobility programs. They are also coming together to take the bundles together, discharge planning as has been mentioned earlier. And what are the outcome you can see on the right-hand side, wherein because of all this, there is a marked decrease which happens in the percentage of so many rates. And this is the outcome base of the value-based program which can be implemented. Now, what are the clinical metrics or the quality indicators? This is just a dashboard. Now, these are the dashboards which you can see in almost all the nurses who are sitting over here, who are having NABH or nursing excellence. So this is not new to you. But how can you implement it? This can be implemented by certain indicators, structure, process, outcome, or experience indicators. Few of the points which has been done earlier, so which I will not go through again. But how have we done it? We have done it through small quality improvement projects. These are the small quality improvement projects which was taken up by the nurses from the hospital, by which it was seen that there were many changes within the organization. We are a high volume hospital wherein 3,000 to 4,000 patients per day footfalls are seen. So there are many incidences which happen. So these are the projects which was taken up. These are the projects which help not only the patients, but it also sensitizes the nurses by bringing about better clinical outcome. So this is a quality improvement project on prevention of adverse fall events in surgical ward bathroom in TMH Mumbai. So this is just an example a sample which I have projected over here. This is one more. This is a photograph of the extravasation which takes place. Though the nurses are highly skillful, sometimes it does happen, extravasation due to chemotherapy. Even though the backflows are good, there are patients who do come up with extravasations later on. So this is how things were checked down and how extravasation has been noted, how we have taken action, and how follow-up has been done. So how we have changed from organization to patient first, and how we have taken respect and dignity, holistic assessment, and participation and engagement. So participation and engagement is what we have seen in the previous slide over here. This photographs, what you see over here, is not by us. We have asked the patient's relatives and we have engaged them in such a way that they become a part of a care, which is very important. So that is how the patients have become better. So it's very important that you take them and for a better care. Information sharing and continuity of care will be involved only if you take everybody into the care. Continuity of care, this is another project which we undertook for mucositis. So in this, all the patients who are undergoing chemotherapy, obviously you know that they do have mucositis. So in this, not only the nurses, but we have involved the caretakers as well, so that the patient's quality of life becomes much better, and the care is, the treatment doesn't get hampered because of the treatment what is going on. Now, technology. Now, there is a hesitation when we speak about technology. Though many of the hospitals do have better technology, ours is an 85-year-old hospital, though we are having electronic records. There are places where there are issues. So electronic medical records and technology does help us a lot when we are capturing data, measuring data, matrices. So this is how it helps us. AI-powered clinical decision support, especially when there is sepsis, these dashboards do help us in analyzing, and we do understand that when a patient is going to have sepsis, and it can help us out. Telehealth, we are having 7 centers, and telehealth helps us nurses in connecting to the nurses across those 7 centers and helps us a lot. So this is how we can help us. Protocols, what we is based over here, we can help the other centers also. So we do have lot of beautiful protocols which you don't even find in the textbooks. For example, interventional radiology. These protocols we have shared with so many centers, and that is how we can help out the nurses. We are a training centers, nurses do come and the protocols are shared. This is how we take the capacity building ahead. The challenges are the resistance to change from the staff who are there, inadequate IT infrastructure. And how can we help them out? The helping is by structural change management, capacity building is one of the major way how we can take them ahead. So enrolling them into capacity building program, short-term courses, small projects which can be taken up and we can take them ahead. What are the key takeaways? Value-based care is just not a financial model, it is a moral compass of modern nursing. If we can do it, I'm sure all will be able to do. Data technology and evidence-based practice is the most powerful clinical tool. The transformation starts with each nurse at the bedside, and we have to take solutions from all of them who's involved in the care, and that is how we are moving ahead. Nursing that is accountable to outcome is the nursing that transforms life, because quality of nursing defines quality of care. Thank you so much.
Distinguished guest, my panelists, dear colleagues, dear friends, and upcoming leaders. As we have come to the end of the session, economics of care, leadership that matters. We all realize that the leadership decision is not only managing the cost, but it also, today, it also maximizes the values for the patient, values for the providers, and values for the organization or the society as a whole. Our distinguished panelist has enlightened so well that how a nurse leader plays a very important role in hospital economics and also add values to patients' care. The leaderships is not only shape the financial stability, but also it maximizes the patient outcome, the quality, it improves the quality care, and also it also takes care of patient safety and the equity of the healthcare organization. This is applicable not only healthcare system but any other service sectors. The same thing is applicable even for our day-to-day service, day-to-day life. It has been applicable. Cost, really it matters a lot when you give services to the patient. Yeah. So today I just would like to just say one line that a smart investment today will reduce the losses of tomorrow. Now the house is open for the discussion. I request if anybody has any questions, you can ask. To my panelists, if you have any question, I request if you want to ask, please ask. Any question? Jyoti ma'am has question. Anything? No? Okay. So at the end, I must say, a true and smart leader understand that when a nurse is empowered, the healing is faster. When a staff is supported, the organization growth is faster, and when quality or the safety of the hospital is taken care, in long run the cost decreases. Thank you.
Thank you, ma'am. Thank you, dignitaries. I would now request the chair, co-chair, and the speakers to kindly move to the photo corner. Thank you.